Good evening, sir.
Hmm.
Sir, my topic is about vicarious liability and informed consent, sir.
Hmm.
So first we'll start with vicarious liability. It's defined as a legal doctrine where one person is held responsible for the negligent act or omission of other based on their relationship. In anesthesia practice, it usually means a hospital or a senior consultant being held liable for the acts of their employee, juniors, or team members performed within the scope of their duties. Legal principle, it is derived from Latin "q fact per allum, fact per se." He who acts through other does the act himself, commonly seen as a employer and employee liability. Conditions of this liability, there has to be 3 points. First, the existence of relationship such as employer or employee or master servant. Second, the act must be within the scope of the employment performed during assigned duties. Third, the act causes harm or negligence to a patient or third party. In context for anesthesia, the hospital or consultant anesthesiologist can be held liable for the acts of junior residents or technician working under supervision, nurses assisting in anesthetic procedures. Mistakes occur in routine hospital protocols. Example, wrong pipeline connection. Examples for such as a junior resident administers an incorrect drug dosage leading to cardiac arrest. The consultant or hospital may be viciously liable if the resident was acting under supervision. Second, if the hospital technician connects the wrong gas pipe, the patient develops into hypoxia, the hospital is liable. Negligent post-anesthesia monitoring by the staff in post-anesthesia care comes under hospital liability. Defense and defenses and expectations. If the employee acted outside the scope of duty or engaged in a criminal act, the employer may not be liable. The independent contractors, example, a private anesthetist hired by a patient hospital may not be liable. Contributory negligence by the patient may reduce the liability. In India, such cases in 1990s in state of Maharashtra, the hospital was held negligible for its doctors. Prevention of vicarious liability. So how do we prevent this from happening? We have to maintain standard protocols and documentation. Ensure there is a proper supervision of trainees and paramedical staff. Conduct regular audit and training. Maintain informed consent and clear delegations of duty. And for our purpose, we can apply professional indemnity insurance. To summarize this, in a legal bias, the employer may be held responsible for the Employees Act. Key requirement: the act should be done in the course of employment. Relevance: there should be the hospital liability for resident or staff. That's all, sir.
Okay. Go ahead with other topic. We'll discuss it after you complete the second one.
Okay, sir. The second topic is about informed consent. Informed consent, it's a voluntary authorization given by the competent patient after being informed about the nature, purpose, benefits, and risk of the procedure. It is both ethical obligation and legal requirement in anesthesia practice. Legal and ethical biases. Ethical principle, it's autonomy. The patient has the right to decide. Legal principle, performing a procedure without consent constitutes battery or negligence. Governed by Indian Medical Council Professional Conduct Act 2002 and Consumer Protection Act. Types of consent: implicit consent for general examination, verbal consent for minor procedures, written informed consent mandatory for anesthesia and major procedures. Components of informed consent in anesthesia, such as the nature of the procedure in informed consent in anesthesia, this particular should be must present. First one is the nature of the procedure, what we are doing, the type of anesthesia. It's a GA, epidural, nerve block, or TIVA, sedation, or local anesthesia. It had to be mentioned. Indication, why it is needed. So, one third point, what are the benefits occurs? What are the fourth point is risk? What are the common and serious complications like nausea to death? Alternates. What's versus regional versus general anesthesia? What are the consequences of refusal? And the name and designation of the anesthesiologist should be written in the informed consent. And there should be opportunities for questions to be given to the patients. In case of special considerations, in emergency cases, implicit consent may be applied if delays or endangers the life. Incompetent patients, consent from the legal guardian or next of the kin. In children's, parental consent is required. In pregnant patients, the consent is from patient herself, not the husband. In anesthesia, specific consent should be separate from the surgical consent. Must include airway management, like example, intubation or LMA or IV sedation, possible of blood transfusion, post-operative ICU stay, post-operative ventilatory support, invasive lines, and use of regional blocks or nerve stimulators. Documentation. In this documentation, the patient should be signed, dated, and witness form in the patient language. Use simple and non-technical terms. Retain copy in medical records. Importance in anesthesia: it protects the patient autonomy. It protects anesthesiologists from medico-legal claims. Build trust and communication. Mandatory under law and professional ethics. Practical steps: explain the patient in the allow the time for the questions. Document high risk conditions such as allergy, previous anesthesia reactions. Obtain witnessed written consent before pre-medication. Conclusion: informed consent is a cornerstone for ethical anesthesia practice. It safeguards the patient right, strengthens doctor-patient relationship, and provide crucial legal protection for anesthesiologists.
Okay.
Thank you, sir.
So this is more of a topic which you have to know as a practicing anesthesiologist. As long as you are a PG or a junior consultant, you don't have much of a problem. But once a hospital employs anybody for as a full-time payment staff, then any mistakes done by the such person employed by the hospital also has the liability to face the legal consequences of the mishap that is happening. So that is the first half of the question, which is called vicarious liability, which is a responsibility trust, even though you are not directly involved in management of the patient. Okay? And similarly, a senior anesthetist who is considered to have some juniors under him who are going to manage cases independently. If any mishap or mistakes happen, the senior anesthetist is also responsible for not properly supervising or training those persons. So that also comes under vicarious liability. As far as the informed consent is mentioned, it is first of all a very important legal procedure or step which has to be followed in every hospital, because without the consent, because every patient is supposed to have an autonomy, that is, they have the independence and freedom to choose what type of anesthesia or surgery they want, how important is that surgery, everything they should think and they should give their wholehearted approval for that. Then only the consent is valid. And without their permission, even touching them amounts to criminal act. That is called battery. So when you go to see an assessment for a patient, the proper procedure is first you introduce yourself. I'm so and so. I'm working as a postgraduate. I'm working as a junior consultant. I'm a senior registrar in such and such department. I have come to uh, check you up as a pre-anesthetic checkup for your surgery tomorrow for anesthesia fitness. So you introduce yourself first and then you start the examination. You cannot just like that go along with the nurse and immediately take the hand of the patient and start checking the pulse and measuring the BP. So all these things should not be done without a proper introduction to the patient, and the patient should permit you to examine him. That is also very, very important. And one point that is missing in your informed consent answer is the language. Vernacular is very important. For example, if you get a patient from North India and you don't know Hindi, you should have an interpreter to give the understand what he says, and the patient should be able to understand what you are intending to tell them. So the informed consent should be obtained after explaining the procedure and making sure that the patient understands what you say is a very important component of the informed consent. And the other point is there are certain special considerations like Jehovah's Witness or an obstetric emergency or patients who are coming for a repeat procedure. For example, you do a laparotomy and there is a bowel gangrene in the second day and you want to do a exploration and remove the gangrenous part. So the first consent you have taken will not be sufficient for the second procedure. So if the same patient is to undergo subsequent procedure, every procedure you should try to get you must get the consent and document it. So it should be procedure specific. And when you explain the procedure or the intended treatment to the patient, it is important the patient understands that, and if we ask any questions, you should be able to answer them. And after making sure that he has fully understood, then only the patient should give the consent. And here you have to use the word competence of the patient. So patient should be in a position to understand that. And there are situations where elderly patients who are hard of hearing, who have mild dementia or Alzheimer's, who come for surgery, you must also mention about the who is in such patients who cannot take a decision on their own. What do you do in that situation? You have to rely on some relative or their own children, blood related or unrelated, or somebody authorized to give the consent on behalf of them. Okay, so that is another important point that has to be included, the competence. What about minor children? It is the parents. And up to what age the minors also can give the consent? So in India, we consider 18 as an adult age, whereas Western countries, they hold only 16 as the pediatric age group. Above 16, they are considered as adolescent, and there they have certain classes of people at this age group who can independently give a consent. So need not be the parents all the time or the guardians who have to give the consent. So that point also has to be mentioned. So this is more of a medico-legal practice question, which is useful from practical point of view, and that is the reason why it has been included in the syllabus, and that is where you have to write these answers for that. I'll just share my